Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Anderson. Thank you for coming in today. How have you been feeling since your bike accident?
Hello, Dr. Martin. Honestly, I've been better. The pain from the fracture in my arm is manageable, but the wounds on my leg are quite bothersome.
I understand. Let's start with your arm. You mentioned a fracture. Can you describe the pain? Is it constant or does it worsen with certain movements?
It's a dull ache most of the time, but it sharpens when I try to lift anything or move it too much. I've been trying to keep it still as much as possible.
Good. Minimizing movement is wise in early fracture healing. Now, about the wounds on your leg. How are they behaving? Any redness, swelling, or discharge that concerns you?
Yes, there's some redness, and it's quite swollen around the stitches. There's also a bit of pus, which worries me. It's also very painful.
It sounds like there might be an infection. We'll need to take a closer look at that. Infections are common complications in open wounds. Have you had any fevers or chills?
No fevers, but I've felt unusually tired. I wasn't sure if that was just from the stress of the accident or something else.
Fatigue can be a sign of your body fighting an infection. We'll definitely address that. I'll also check if there's any nerve damage or other complications from the fracture that might be affecting your overall condition.
What kind of treatments are we looking at if it's an infection?
Firstly, I'll take a swab of the pus to identify the exact type of bacteria, which will help us choose the right antibiotic. You might need a course of antibiotics and possibly a change in your wound dressing to something that promotes better healing.
And for my arm, how long do you think it will take to heal?
Fractures typically take 6 to 8 weeks to heal, but it depends on the severity and the location of the fracture. Since it's your arm, we want to ensure proper alignment and healing to avoid long-term mobility issues. We may need to do some imaging today to see how the bones are aligning as they heal.
Will I need surgery for the arm?
It's too early to say without the imaging. If the bones aren't aligning properly, or if healing isn't progressing well, surgical intervention might be necessary. But let's not get ahead of ourselves. We'll review the images first and discuss your options.
I understand. And how can I better manage the pain in the meantime?
For your fracture, I can prescribe some pain relief medication that won't interfere with the bone healing. As for the wounds, once we manage the infection, the pain should start to decrease. Keeping the leg elevated can also help reduce swelling.
That makes sense. Is there anything specific I should be doing at home to help with the healing process?
Absolutely. Nutrition plays a big role in healing, so ensure you're eating a balanced diet rich in vitamins and minerals, particularly calcium and vitamin D for your bone. Also, try to keep the wounded area clean and dry, and follow the wound care instructions we discussed.
I will. Thank you for all the information, Dr. Martin. It's a lot to take in, but I feel more at ease knowing the plan.
You're welcome, Mrs. Anderson. Let's get you scheduled for the imaging and wound care follow-up, and I'll see you back here next week to review everything. We'll take it step by step to get you back on your feet as safely and quickly as possible.
Thank you, Dr. Martin. I appreciate your help.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I wanted to discuss my health, as it's been quite a journey, especially these past few months. As you know, I've had some suspicious cells in my prostate that have been concerning me. The idea of waiting a year to recheck is making me anxious. On top of that, my hemoglobin A1C has jumped up recently. It's at 6.1 now, and I'm worried because it was always in the 5s before. I haven't changed my diet significantly, so this uptick is puzzling.
I understand your concerns. It's natural to feel anxious about these changes. We'll keep a close eye on your prostate as well as your blood sugar levels. Monitoring is key here.
Yes, and then there's my heart history. Having had 2 heart attacks in the past, I've always been cautious. Skipping knee surgery because of the risk really set me back physically. And now there's also the liver biopsy that we had to postpone because of the confusion over my aspirin intake. My spleen and liver enlargement, plus the low platelet count, it's all a bit overwhelming.
We will definitely reschedule your liver biopsy as soon as we clarify your medication use and ensure it's safe to proceed. It's crucial we understand the cause of your splenomegaly and hepatomegaly.
And my pacemaker. The recent check was okay, I believe. They might have changed the generator. I remember them mentioning something about that.
Yes, the pacemaker generator was indeed replaced, and all the impedance checks for the leads came back normal. It's functioning well, which is excellent news for your heart.
That's a relief. I've also been using acupuncture, which has surprisingly helped a lot with my knee pain and overall well-being. It's been quite effective.
That's great to hear. Integrating such therapies can significantly improve quality of life. Keep up with the acupuncture if it's helping.
Certainly. On top of that, I've been keeping track of my own health metrics. My morning blood pressure has been a bit high, around 140-150 systolic, but it improves as the day goes on.
Regular monitoring is good. We'll think about whether adjustments to your current hypertension medication might be needed, especially in the context of your other conditions.
I've also had issues with my cholesterol. I'm still on medications for that, and Senna for bowel management. I keep a strict routine with my medications.
Staying consistent with your medications is important. Let's review those cholesterol levels as well and see if any further adjustments are needed.
My recent blood work showed that my LDL is a bit high, and my triglycerides too. My liver function tests came back with ALT at 45, AST at 50, and alkaline phosphatase at 130. And well, My platelet count was lower at 120,000 per mealing.
Thank you for that detailed update. It helps in assessing your overall health and managing your medications effectively. We will continue to monitor your PSA levels and consider repeating the biopsy sooner if there are any concerning changes. We'll aim to stabilize your hemoglobin A1C through potential diet adjustments and monitoring. It's crucial to keep it under control. Regular follow-ups on your heart function will continue. Your pacemaker is working well, which is reassuring. We'll reschedule your liver biopsy as soon as we verify the safety regarding your aspirin use. This will help us understand the underlying cause of your enlarged liver and spleen. Given your morning blood pressure readings, I suggest we increase your lisinopril from 10 milligrams to 20 milligrams. We'll monitor how this adjustment affects your blood pressure over time. We'll continue with your current cholesterol medications and review their effectiveness in our next visit. Regular blood work will help us stay on top of this. Continue with your exercise regimen and acupuncture, as these have positively impacted your health. We'll schedule follow-ups for ongoing monitoring and adjustments to your treatment plan as needed. It's important to keep proactive in managing your health, just as you have been.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
As the new IT manager at the hospital, my focus has been on upgrading our health information systems to ensure data security and patient confidentiality. With the recent increase in cyber threats, it's crucial that our systems are not only compliant with the latest health regulations, but also equipped with advanced security protocols. I work closely with the hospital administration and clinical staff to ensure that the transition to these new systems is seamless and that everyone is trained on the importance of data security. Our goal is to protect patient information while enhancing the efficiency of our medical services.
Now look at question 26.
Good morning, everyone. Today, I'd like to discuss the innovative approach we're taking towards managing chronic pain without relying heavily on opioids. Our pilot program integrates physical therapy, acupuncture, and cognitive behavioral therapy as part of a comprehensive pain management plan. Initial results from our study, involving 100 chronic pain patients, indicate a significant reduction in pain levels and a decrease in opioid use among participants. This multidisciplinary approach not only addresses the physical aspects of pain, but also the psychological, promoting a holistic recovery and improving our patients' quality of life. We are encouraged by these findings and plan to expand the program further.
Now look at question 27.
I've noticed you've missed a few appointments lately. Is everything all right at home?
Honestly, it's been tough managing my diabetes with my work schedule. I often forget to check my blood sugar or skip meals.
It sounds like you're juggling a lot. Managing diabetes effectively does require a consistent routine. Maybe we can explore some tools or strategies to help remind you, like setting alarms or using a meal planning app.
That could help. I haven't really used apps much, but if it keeps me on track, I'm willing to try anything.
Great. I'll show you a few after our session. We'll work together to find a system that fits into your lifestyle and keeps your health in check.
Now look at question 28.
Let's discuss our emergency response protocols. There have been concerns about the efficiency of our current system.
Yes, I've noticed the delay in emergency equipment delivery to the scenes. Our response times need to be faster.
Exactly. And ensuring that our equipment is ready and functional at all times is critical. Have we looked into the possibility of conducting regular checks and drills?
We started weekly equipment checks last month, but drills are something we haven't done yet. It might be good to simulate a few emergency scenarios to see how well our team responds.
I agree. Let's schedule some drills over the next month and reassess our protocols based on those outcomes. It's vital that our team feels prepared and confident in real situations.
Now look at question 29.
I reviewed your recent patient interactions, particularly with difficult cases. You handled them well, but there's room for improvement in patient communication. Could you explain how you approach these conversations?
I try to be clear and direct, but I'm often concerned about overwhelming the patients with too much medical jargon. It's a balance I struggle with sometimes.
Understandable. It's essential to be clear but also empathetic. Using simpler language or analogies can make a big difference. Have you tried using visual aids or handouts?
Not frequently, but I see how that could be beneficial. I'll start incorporating more of those tools into my discussions.
Excellent. Let's also schedule some role-playing exercises in our next training session to practice these skills.
Now look at question 30.
During the cardiac rehab session today, I noticed some patients were less engaged than usual. Do we need to adjust the program to better meet their needs?
That's an important observation. Engagement can directly influence patient outcomes in rehab. What changes do you think could increase participation?
Perhaps varying the exercises or including more group activities could make the sessions more dynamic and less monotonous.
Good ideas. Let's try integrating more interactive activities and monitor if there's an improvement in attendance and engagement. Keeping the program adaptive is key to maintaining its effectiveness.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good morning, everyone, and thank you for joining today's webinar on the advancements in heart failure management. I am Dr. Maria Gonzalez, a cardiologist with a special interest in heart failure treatment. Today, I will discuss the significant strides we have made in this field, exemplified through the case study of a patient named John, a 65-year-old male diagnosed with chronic heart failure. John's journey began with typical symptoms: shortness of breath, swelling in the legs, and persistent fatigue. These symptoms are commonly associated with heart failure, a condition where the heart struggles to pump blood efficiently. John's initial management followed traditional guidelines: diuretics to manage fluid overload and ACE inhibitors to improve heart function. However, John's condition highlighted the need for a more tailored approach. Research indicates that heart failure treatment can significantly benefit from personalized medicine, especially as the condition progresses. A pivotal study published in the Harvard Heart Letter outlines the efficacy of integrating biomarker assessments into routine care. By measuring levels of specific biomarkers like NT-proBNP, clinicians can better assess heart failure severity and tailor treatments accordingly. In John's case, biomarker levels indicated worsening heart function despite standard therapy. This insight led us to adjust his medication regime. We introduced a beta blocker and an angiotensin receptor neprilysin inhibitor, which has been shown to reduce mortality in heart failure patients significantly. This decision was based on findings from a comprehensive review in the Journal of Cardiac Failure that evaluated the long-term benefits of ARNIs in reducing hospital readmission rates and improving survival. Technological advancements have also revolutionized how we manage heart failure. John was enrolled in a telehealth monitoring program that tracks vital signs and symptoms through wearable technology. This real-time data allows us to make quicker adjustments and preempt worsening symptoms. A recent article in Harvard's Technology and Heart Health Journal discussed the potential of these technologies to transform patient outcomes by providing continuous personalized data. The role of lifestyle interventions cannot be overstated. John's case emphasizes the importance of integrating dietary adjustments, exercise, and weight management into the treatment plan. A randomized controlled trial cited in the Harvard Health publications demonstrated that patients with heart failure who engaged in moderated physical activity had a 27% lower risk of death and a 25% reduction in heart failure-related hospitalizations. Patient education and empowerment are crucial components of contemporary heart failure management. John attended heart failure management workshops, which are supported by studies from Harvard Medical School, showing that educated patients are more likely to comply with treatment regimes and lifestyle changes, reducing their risk of complications. Looking ahead, the future of heart failure management is promising. Ongoing research is exploring the use of gene therapy to reverse heart failure. Furthermore, advances in artificial intelligence could enhance diagnostic tools, predict outcomes more accurately, and personalize patient treatment plans even further. John's case study reflects the broader evolution of heart failure management, from symptom management to a comprehensive, personalized approach. Our goal is to not only extend life, but also improve the quality of life for our patients. As we continue to incorporate more sophisticated diagnostic tools, targeted therapies, and patient-centered care models, we are witnessing a new era in the treatment of heart failure. Thank you for your attention. I invite any questions you may have about this exciting field and our ongoing efforts to improve patient outcomes in heart failure.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today we're discussing the management of chronic kidney disease, CKD, and cardiovascular risk, a critical area in nephrology, based on a recent case study published in a Harvard journal. With us is Dr. Susan Clark, a leading nephrologist. Thank you, Dr. Clark. Can you first explain why CKD patients are at a higher risk of cardiovascular disease?
Certainly. CKD and cardiovascular disease share several risk factors such as hypertension, diabetes, and chronic inflammation. The kidneys play a vital role in regulating blood pressure and filtering wastes and excess fluids from the blood, which can stress the heart when impaired. Over time, this can lead to heart disease.
Can you illustrate this with a case study?
Absolutely. Let's discuss the case of Mr. Thompson, a 58-year-old male with stage 3 CKD, initially managed by primary care but referred to a nephrologist due to escalating cardiovascular risk factors. Mr. Thompson's history includes hypertension and type 2 diabetes, both poorly controlled, contributing to his CKD progression.
What management strategies were applied in his case?
Mr. Thompson's management was multifaceted. We started with optimizing his blood pressure and glucose levels through medication adjustments and lifestyle interventions. Notably, we introduced a sodium-restricted diet and increased physical activity. These changes aimed at slowing CKD progression and reducing cardiovascular strain.
What specific medications were used?
For hypertension, we prescribed a combination of ACE inhibitors and calcium channel blockers. To manage his diabetes, we adjusted his insulin therapy and added a SGLT2 inhibitor, which has benefits for both blood sugar control and cardiovascular health in CKD patients.
Was there a focus on any specific cardiovascular interventions?
Yes, due to his elevated risk, we closely monitored his cardiac function. This included regular ECGs and echocardiograms to track heart health. We also started a statin for cholesterol management, crucial for reducing heart disease risk in CKD patients.
How was the outcome of these interventions?
Mr. Thompson's case is a good example of integrated care. Over 6 months, his blood pressure and blood sugar levels improved significantly. His kidney function remained stable, which is a positive outcome in CKD management. Importantly, he reported feeling better overall, with more energy and less fatigue.
What are the broader implications of this case for CKD management?
Mr. Thompson's case underscores the importance of a holistic approach in CKD management, especially in reducing cardiovascular risks. It highlights the need for early nephrology referral, integrated care strategies, and patient education to effectively manage both CKD and associated risks.
What should healthcare providers take away from this?
Healthcare providers should be proactive in identifying CKD early, especially in patients with diabetes and hypertension. Collaboration among primary care physicians, nephrologists, and cardiologists is crucial to managing the complexities of CKD and preventing cardiovascular complications.
Lastly, where can our listeners find more information?
I recommend consulting the latest guidelines from the National Kidney Foundation and reviewing recent studies in nephrology journals. These resources provide comprehensive insights into managing CKD effectively.